You were on mute.
Yes.
Mary?
Yes,
Mary's
I'm here.
Deborah?
Present.
Eric?
Eric's here.
Charlie? Director Murphy here. Was. Bruce Murphy?
He's present. Present.
Present. Okay. Very good. Let's hit the agenda. The first item is public comment, and I would just ask if anyone would like to speak, this would be the time. However, I think since there is a vote related to the coronavirus, perhaps those comments we can wait on until a little further in the meeting here when we address some of the issues with the pandemic. So if any other comments or issues someone would like to address the board with, now would be your time. Okay. Hear anything? Director Murphy, anyone interested in addressing the board?
We do have our first hearing tonight. We could go right into, Mr. Chairman.
Okay, we're set. That's good. Number 2 on your agenda, board members, and it's a hearing. Retail tobacco violation, and location is 457 Station Avenue, convenience store in South Yarmouth. I have a copy of a letter that was sent from the health department to Mr. Shukla, I believe. And just so the people at home who are listening by phone, this is the letter. On November 9th, 2021, a Barnstable County health inspector conducted a retail tobacco check of your retail store. A copy of the inspection report enclosed. They found the humidor unlocked. You are in violation of the Board of Health Tobacco Control Regulation, Section L, that prohibits self-service displays, including humidors, which must be locked. You are hereby ordered to pay a fine of $300. It's the first offense as required by the Board of Health Tobacco Control Regulations, Section R, prior to the Board of Health meeting of December 6, 2021. And then there's a request for you or someone representing you to this meeting tonight. Bruce, any other comments on this?
Yes, one is we're just a little scratchy here, and I'm not sure where that's coming from. Are you aware, Erica, with that scratching?
Yeah, I'm trying to get in, but he's not opening the door.
Okay.
I think it's wrong.
You think that might be from IT in the back? Okay. But I'll go
We need
forward.
to start over. Bruce, Bruce, do we need to start over?
Yes, we were just looking, it was very scratchy, the meeting. So we're checking with IT right now just to make sure people can hear at home, which I believe they can. What we have is a tobacco violation, as you mentioned in the letter, Mr. Chairman, and that was from an inspection from the county tobacco control person. And that goes back to the date of November 9th, at about 1:30 in the afternoon, at which time he noticed one of the humidors to the side of the counter was unlocked. Here's the picture right here that shows it to the side of the counter. One of the humidors is behind the counter. Then you have 2 others that are outside the counter. So it would fall under the humidors as single service displays. The owner is here and we'll discuss it. But I've also met with him up there tonight and just wanted to verify that it was to the side, and he'll go into it. This store and the owner has been very cooperative in working with the board and the tobacco regulations. Have not had a violation at this or the other store in over 2 years. There's been no age 21 violations. I think what happened on this one that you'll hear from the owner is they were putting water in the humidors where they unlocked the cases at that particular time. And then they had somebody come to the cash register to direct cash out on a particular item. And at that time, the humidor was unlocked was not relocked. And that happened to be the time when the county inspector was in. And the owner will talk about the precautions they've been taking, how it goes, and the experience that they have of the employees. So with that general background, we do have the owner available, Mr. Chairman and board members.
Great.
Okay, you want want him to say a few words right now?
Yeah, just introduce yourself, and if
Yeah.
you have any comments, please go forward.
Yes, all the respected board and the chair also. This is Vishal Shukla, owner of Station Avenue Convenience Store and Dorgan Street, C Street or?
Oh, that's fine.
So I hear and I served the letter from Phil, and it says like the time, the inspection, the humidor was unlocked, which is, I'm not saying it's not true. It is true. The time of the inspection though was unlocked, but sometime what we do is to keep the humidor or the cigars in the humidor fresh. When the water level goes down, we try to refill the humidor. And I think my employee, they have been there for almost 3 years, very good employees, and never, never say, I don't say anything bad about them because they're very good employees. They check the IDs and everything, and they follow the rules and regulations.
Years.
And they've been working for almost 3 years to the store, and they know all the regulations and everything. But she was trying to fill up the humidor with the water, so she has to unlock the humidor and to fill up the water. That and the inspection occur at that same time. So there was only one reason. There was the unlock. We kept it locked all the time. He did inspect before too, and they were always been locked. So I did not have any violation at all on that store or my other store in Yarmouth Port Village store, which is I own for almost 5 years now. So I'm going to be leaving up to you guys what can be done. And I'm doing all my precautions. Like I'm telling them now, I said, listen, it's no ifs and buts on like what happened and what not, but we have to make sure whenever you fill up the humidor, we need to be locked right away. It's no ifs and buts. So they understand that. So I would leave it up to you guys, what can be done. And
What other training do you, or reminders do you talk to your employees at both stores? I mean, how often do you talk about tobacco safety and precautions?
well, we go over pretty much, every other month, and I'm there every day
Mhm.
now for like half an hour for each store anyway. And we go, and they know it's not, it's for a few bucks. It's not, they're not going to risk my license for that. So they know everything, and they train well, and they check, even just like I say, if I'm sitting right next to them, and if my wife works there, if somebody comes in and if she asks the ID, I did check the ID before for the same guy, but I tell them, I said, listen, if she asks the ID, she has a right to see the ID. I'm not going to involve anything. He says that if you don't have ID, you can go back, take the ID and come back, and we'll serve you. That's it.
Okay.
That's what we do.
And are you finding more under age 21 people trying to come in, or is that decreased or increased?
No, actually, that's because of our strict regulations and our strict policies for the store. I see lots of underage people gonna try and come and try and buy the cigarettes or anything, because they know if they go into the store, we will not serve them, that's for sure. Or we will ask the ID first before even they do anything. So for particularly my store, I would say the rate went very low. That's for sure. Absolutely.
Less people coming in to try to buy
Yes,
because they know how
yes.
strict you are.
Absolutely.
Okay.
Absolutely.
Are we able to get that picture of the humidor up on the presentation screen? Just so the people at home can just see, I don't know if that will slip pot in, if we could check on that. Just give us 1 second.
Bruce, while that's happening, can I ask a quick question?
Yes.
It said also that there was a sign violation in addition to the humidor. Can you expound on that?
Yeah, let me take a look. I would have to check. It does say missing sign other, but it wasn't checked off, so I'm not quite sure. I believe you have the signs that you need, age 21, and so forth.
Yep.
Uh,
And I think Mr. Bob Kulit left me extra signage also.
Okay.
Yeah, so we already have posted everything, but he left us some extra signage also, yes.
Okay.
It's right on our counter and as well as in the door.
Okay. Thank you. I guess, Mr. Chairman, any other board comments?
Mary, I think you're on mute.
I'm sorry. We saw the humidor slide briefly, and then it went back to Mr. Chukla. Could you show the humidor slide again and exactly where that humidor is,
Yes.
please? Okay,
There we go.
yeah.
If you're looking at that,
There's a notch on the top.
the closest, the to the right, is the first humidor. I guess there's three humidors altogether.
Right.
So
Okay.
the one to the right is all the way out past the counter. The second one or the middle one is probably 50-50. Then the third one, it's a tough angle. That's behind the counter. So one and 1.5 is roughly behind the counter, would not be a violation. It's just the second half and this last one that was unlocked.
Right.
Okay.
But it was unlocked, and I'm not clear if it was open or just closed and unlocked. Do you know if it was
No,
slid? Was it slid open, or did she close it back? Just not
No,
locked it.
it was locked, but the lock was open because she has to, slide it and put the water in and slide back and put the lock on.
So it was slide closed then? It was closed but not
Yeah.
locked?
Yes. Yeah.
Okay, thank you.
Anyone else on the board? So, Director Murphy, what's our responsibility tonight?
This is being brought to the board as per the Board of Health regulations on tobacco. It is a first offense.
Right.
There's no warnings anymore. The first offense is a $300 violation. So that's the board's determination if in fact there was a violation.
So, what do you decide that? How they want to address this?
Well, it does seem like a violation. However, it also seems like it could have been a pretty honest mistake. So I'm wondering what our options are for if we choose to provide a little more leniency, if that's something everybody's interested in or not. I'm not sure how have things like this been dealt with in the past.
These over the years have been difficult. Obviously, this gentleman has a very good record. Sounds like pretty awful timing. The issue always comes down to how do we treat everyone equally? Address this problem. It always is, well, how do we judge the next one if it's a little different story, or the next person says, well, the one before me didn't pay a fine. That's the predicament generally we're in.
So I'm with Eric on this, but I have to say that it's a snapshot in time, right? And it just so happens that the snapshot was taken as an auditor came in to look at it. So, it stinks, but unfortunately, I think to Hillard's point, we have to be consistent with everybody.
Any other thoughts, or if not, someone can make a motion and we'll vote on whatever the motion is.
Just a quick question, because I don't have it in front of me. What are the repercussions for a second offense?
I
The
believe,
fine goes up, right, Director Murphy?
yes, I believe it's $400.
Yeah, I think so.
And then the third offense is 500.
Okay, so this type of violation does not result in a suspended license?
Correct.
At
That
any-
is correct. Mm.
Well, I move that we move forward with the $300 fine.
Second,
Okay, any further discussion? I don't hear any, so let's vote. All in favor of the motion, just raise your hand and say aye.
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 Okay, it's unanimous. Okay. So Director Murphy, what about the payment? When does that need to take place by realistically?
I would say the fine should probably be paid within the next 7 to 10 days.
That's fine, but for
He's mentioning that he is available to pay the fine tonight.
that's
you.
great. And let's, hopefully the timing is better in the future for him.
Yes.
right.
Okay,
All right, thank you.
Thank you.
let's move down
Thank
here. The third item here is an update and discussion on the coronavirus. And this includes some statistics, vaccination rate, positivity rate, and mask advisory vote. And anyone from the public would like to speak, this would be a good time to address any of the issues of coronavirus, any issue dealing with the pandemic and the town of Yarmouth. Looks like we have one hand up.
Okay, we do have a speaker.
Gentleman can introduce himself and
Mr. Chairman, can you hear me?
yes, we can. Thank you for coming in.
Hi, Mr. Chair. My name is Joe Glynn, Precinct 6. I have some rhetorical questions. I understand you have your own requirements for deliberations. I just want to pose some questions for the public edification and maybe to help you in your decision, in your decisions tonight. One question that I have that you might be able to answer, because you just spoke on it, is the mask advisory, is it an advisory or a mandate, would be the first question. And then the other rhetorical questions I had was in regards to any of the businesses or restaurants or other establishments. Has there been any cases over the course of the pandemic that have been tied to contacts in restaurants, contact tracing or contact surfaces in restaurants? And if so, how does that compare to, I know I've heard Director Murphy talk about cases recently of wine parties and the like, private functions, but I haven't heard over the course of the whole pandemic any cases that are tied to restaurants or business establishments or other public places, whether it be town meetings or anything. So I'd like to know that. And then I don't know if it was brought up at a previous selectmen's meeting in your presentation, if we are looking forward to doing testing, antibody testing, as opposed to, I think our increased rate might have to do with some of the mandates for, like the county is mandating their employees. So more people are testing, and therefore you're getting a higher positivity rate. But I'd like to also see the positivity rate per population, because of course, when you have more people who are testing, you're going to have a higher, you're going to have more instances, but that doesn't reflect the greater population of Yarmouth. And then the last thing I'd like to just say is our businesses, and I had many requests and inquiries about tonight's meeting from businesses and other people concerned about this. Our businesses, especially at this time of the year, they provide, taxes and town money. Some have gone out of business, and over the course of time, they might be in the millions of dollars of tax revenue to the town and the town resources. So I just caution you to think about that and ask that you look at those questions. But I appreciate your time, and I appreciate what all you are doing. I know it's a concern of public health, and I know that's always on the back of your mind. I'm a retired firefighter, EMT, so I'm always concerned about public safety and public health. So thank you very much again, and have a great evening.
Well, anyone have any comments right now? Certainly. I mean, there are a few issues there. But we can see if anyone else wants to speak from the public. If not, we can start among ourselves.
One more.
Is there anybody else that wishes to get in right now, Erica? Yes? We have one more to speak, and then I have a few comments I could respond to a couple of the speakers if you wish, Mr. Chairman.
Yeah, I'd like to also. So there's one other speaker?
Yes, we
Someone
have
out there?
another speaker we're letting into the meeting now.
Great.
Mary.
Um,
Mary. You can speak, Mary.
Is that Mary?
Mary Vilbon.
Oh, Mary Vilvon, you can speak now.
Thank you. Mr. Chair and committee, I also will be interested in hearing your response to Mr. Glynn's questions, but I also wanted to reiterate how difficult this time of year is for our business community. And that right now I have, as the executive director of the Yarmouth Chamber of Commerce, talked to many of the restaurant owners and general managers, as well as the owners of retail stores, who feel that right now the advisory that we have in place is sufficient, and that by putting in a mask mandate could have a negative impact on their businesses. And we just wanted to convey that message to you in your conversation for this evening. Thank you.
Yeah, I'm just gonna make one comment right now, which is really addressing both individuals just now. What's on the agenda for tonight is an advisory. It is not a mandate. It's not a policy. It's not a law. It's an advisory that's in front of the board tonight. There is a mandate, and that has something to do with wearing a mask in town hall at meetings. There was an advisory back in August, but it's really only an advisory that's in front of us tonight. I can make one comment about the positivity rate. To keep in mind what a positivity rate is, it's really what percentage of people getting tested, whether they're positive or negative, not the number of people that are positive or negative. So if you had a town with 10 people and 8 people were positive, then the positivity rate is 80%. If you have a town of 10 people, 1 person turns out to be positive, then the rate is, it's 10%. So that's what the positivity rate is really looking at. It's looking at the results of number of people, not the number of people. Those are two different concepts. Bruce, you had a comment, something you wanted to say. Bruce, was there one comment that you wanted to make, or did you want to go into just kind of reviewing and
Follow
bringing
up
us
on
up to
that
date?
yes, you are correct, Mr. Chairman. Before us on the agenda is just for Board of Health advisory. It's not a mandate. The board will be discussing it later. It's just a stepped up enforcement. The first step would be an advisory townwide indoors in the public areas, encouraging people to wear a mask in those areas. Should the board review, we'll be reviewing the positivity rate and the vaccination rate over the next several weeks. And if it continues to climb twice the state standard and higher than the county standard, the board would look at possibly other precautions. But right now, in the stepped enforcement or precautions, this meeting tonight is just for the board's advisory. The question is, have we seen any clusters in any restaurants? Right now, no, we have not. We have had individual cases within restaurants of either employees or patrons or one or two patrons, but we have not seen a large cluster like we have at a couple other locations, which is helpful because we do on the tracing ask people where they've been over the last, 48, 72 hours. So we have not had a large response come in at one particular case.
Bruce, along those lines, on the issue of tracing, things have changed drastically during the course of the pandemic. If you go back to March, April, May, June, all of 2020, there were many hired people in the state to do tracing, and there weren't that many people turning positive. In other words, the pandemic had not spread to the point where we are today, where there are really too many cases that allows for tracing at this point. So things have changed. It's very different whether if it's a nursing home where everyone is in one place. It's much easier to test people and find out whether or not there's a group that is positive at one time. Very different than at a store or at a restaurant. It makes it much easier if it's long-term living, that kind of place.
The other comment I have too about restaurants is that many of them went to takeout only. Many of them opened up outdoor seating, and not just in Yarmouth, but just across the board everywhere. For a time anyway, most of them were requiring masks, except when people were eating. The servers certainly always have had masks on that I have seen. So I think that there were precautions in place that probably helped the spread of the infection from someone in the restaurant to a patron or a staff person.
Bruce, perhaps you can take us through some slides and just give the board an update as well as the public of where we are and why this advisory is even on the agenda. That may be of some use. I know you prepared some slides for us.
Go back to the first slide. You jumped ahead too quick. Go back. Okay. Thank you for going forward tonight. We do have the next slide of the list of the board members for the people at home. That's there that are all on the meeting tonight. Charles Holloway, as you mentioned, was not present tonight. Thank you. Obviously we put the Board of Health mission in here just for the people at home, but the mission of the Board of Health is protecting the health and environment of the residents through enforcement of state and local regulations. administrating health and safety programs, and proactive planning and regulations and preventive programs. Okay. So our updated slide of daily cases of the Delta variants is up here. You can see when the coronavirus started March 11th in Yarmouth, the first wave 2020, and even during that first several months, the cases really just peaked out at about 40. We went into the summer of 2020, very low cases, went quite a few days without a case before it started upticking a little in October, and then it really right around after Thanksgiving, it spiked right up on the 28th, the 30th. You could see it spike up, which was the second wave, where we were seeing 160, 170 active individual cases within town. This is just Yarmouth. And then it would drop down, and it peaked a little after December. Then it dropped down and then picked up again for the third wave. Going into this summer, we thought with vaccinations, more being outside, that we were probably on the right track, and summer was going very good. And until July, we started to see the uptick of the Delta variant come in, which started the fourth wave. And you can see we peaked right up quickly to 40 cases per day. And then as we got into October, we were over 40 cases a day to 50. And then when we went into November now, you can see that, we're up to 60, 70 cases. And then up until today, we're up over 100 cases. So you can see the increase of this fourth wave has been high in numbers and increasing in the numbers that we are seeing. Again, this is daily cases that are coming in. And just for a little quick background, last Wednesday, which would be December 1st, we had 20 cases a day came in. And then Thursday, we received 18 cases. Friday was 17 cases. And Saturday, we received 10 cases. The cases we receive are through the state tracking program, and they go to copies to us, and they go to copies to the county health department that does the tracing for our health department. They'll be making the calls. Part of the questions, as I mentioned, where have you been the last 48 to 72 hours? Where have you visited? Who else is in the house, and whether they need to go get tested or take quarantine or safety precautions. If there's school-age children, we will reach out to the school nurse to stay in contact with the school. So that's the overall daily cases that we monitor, again, daily. Okay. So as of yesterday, because the cases keep changing, this is what we can see right now. As of yesterday, we had an active of 111 cases in town, positive cases. Okay. Then we looked at the whole month of November. The last time we had looked at the partial month, but we did is Phil Renault, that works in the health department. That's the one of our food inspectors, health inspectors, that spends a couple hours or 2 to 3 hours a day on COVID cases and callings. Put together looking at November. During that period of time, Yarmouth received 246 positive cases. That breakdown was 130 people were not vaccinated, and 116 were vaccinated. So it's close to a 50-50 split. The vaccinated ones had a lot milder symptoms than from what we understand, than the vaccinated. Okay. We then looked at, where does this 246 further break down to when we look at an age group, and I'm hoping it's not too hard to see at home because maybe we should break it out into 2 slides. But we tried to look at, out of the non-vaccinated 130, where was that positive cases coming from? And it was the highest was in that age group 1 to 11 that wasn't getting vaccinated at this particular time, where we had 31 cases in that group. And then it went down to the next group of between ages 20 to 49. We had 30 and 25 in those 2 categories there. In the vaccinated people, where the 116 positive cases were, it went down to the age 30 to 49 had 33 cases, and then 50 to 64 was 34 cases, and 65 to 74 was 24 cases. So we're just trying to break it down to see, where the positive cases coming from, and then we can use that for what we can do for education and setting up vaccination locations and education for those age groups. Okay. How does our Yarmouth positivity cases look when we look at the percent overall compared to other towns? This was last week's data provided by the Department of Public Health over a 2-week period. The Yarmouth positivity rate was 7.33, and that was based on 149 tests, positive cases out of 2,034 tests. Again, as you explained, Mr. Chairman, that's just that sample that's being tested. So we were, as you can see down the bottom, the state average is 3.6% positivity rate. The county is almost almost twice that at 6.7. So you can see quite a few of the Cape towns are well over twice the state positivity rate, and then over the county percent.
This is a large spike for Yarmouth then. What were we were at just over 5. Am I correct? The last
Correct.
time you were
Yep.
presenting this?
Yes. So we've seen a increase in the number of positive cases. So as you can see, the number of cases where Yarmouth is showing 149, obviously right above us is Barnstable at almost 300. That would probably make sense. Their town's twice as large. But then you have Sandwich with 139 cases at a positivity rate of, 7.75. And then you have Dennis with 93, almost 100 cases at a higher positivity rate at 8.30. So that's where we look. We can see the positive cases of the COVID, pretty much across the Cape and increasing over the last 2 weeks. Okay. Yarmouth positivity rates, we should probably break this out, but if we go down to the bottom, maybe you can show Erica, we're at 7.33. And as you mentioned, Chairman, last week we're at 5.96, just under 6. And before that, we're at 4.77 and then at 5. So the town of Yarmouth's positivity rates have been kept increasing the last several weeks. Along with the number of positive cases within town. Thank you. Clusters, we've seen this before. A youth hockey team with a positive case that spread to a couple others. The dinner wine party that had 10 people that we had several associated with. A nursery school that did not have a lot of cases, but they closed for a day for a deep cleaning. So a number of children were not able to go to the nursery school. And then we had a group home in town that we've had several positive cases associated with. Okay. Hospitalizations, we can see that has been increasing. Last week, this data is provided to us through the county department. And as of December 2nd, Cape Cod Hospital had 21 people in the hospital with COVID and 2 within ICU. So we can see that's been an increase. The week before it was 18. And that's before that it wasn't not as high. So we're seeing a lot more people going to the hospital. Okay. How does Yarmouth hospitalizations look for the number for November? There was 11 people within Yarmouth that needed to go to the hospital. And this is their age breakdown. And there's 2 40s listed up there because that is 2 people that were in that age group. And I want to say approximately half of them had been vaccinated. But depending on underlying conditions, some of them needed to go to the hospital. Okay. As we start December, we've had 3 people go to the hospital already with these 3 ages right here. Okay. We go into fully vaccinated, and I again hope this can be seen at home. If not, if people can let us know, we'll try to break the slide out more. But this is based on vaccinated people. You can see Yarmouth, we're down at 73%. I mean, we have over 17,000 people vaccinated in town, but our population is over 24,000. So some
Excuse me,
towns
Bruce, what would,
were,
Bruce?
Go ahead.
Yeah, the 73%. Do you have another percentage that we had earlier in November or October? Do you have
We
it?
were probably at
72.
71. Go ahead, excuse me.
It was 72% earlier, right?
Yes, it really has not been going up very much over the last month.
Right.
You'll look at, just in comparison, you'll look at Dennis, who has 80% vaccination, yet they had the second highest positivity rate. So it's, it's a challenge out there. Just because you have a high vaccination rate doesn't mean that you're automatically going to get a lower positivity. So I just think it's interesting that as we follow and try to educate the people more about being safe and getting vaccinated, we need to increase that number. Right now we're at fourth from the bottom with these towns, and some of those have higher positivity rates. So I think it's something the board needs to keep and the departments keep working on is education and being safe and vaccinate. How does that vaccination rate that we have, the 17,000 people, how does that break down? And we look at this to the numbers that we have fully vaccinated. I think you can probably point that out a little bit, Erica, in that column right there. That's the fully vaccinated. And children are just now starting to get vaccinated, the age 5 through 11. So you can see we're only at 14, but that was a new 14 that the data just came in. But if we go down to the next group, the 12 through 15, you can see out of about 834 were vaccinated 470, but we only picked up 2 children from the week before. And then we get up into the high school that 16 through 19, that there's a potential of 700 and almost 800 students. Vaccinated is 586, but we only picked up 4 from the week before. But, we're in at 76% right there.
Bruce, can't see
Yeah.
the bottom of that slide. Are there, in other words, it looks like a +8. Is that the last additional number that we have for people who got vaccinated now?
No, that number plus 77 is that we had 77 people vaccinated last week from the week before. So
what's the total then of the people who got vaccinated last week, who became fully vaccinated as of last week? What was the change?
77 new people became vaccinated for a total of 17,609. So we're trying to look
77.
at how many people are getting vaccinated each week and what that total is by age group.
Well, you're saying 77 people last week that they've become fully vaccinated, 77
Correct.
people?
Correct.
Well, I mean, that's very small. I'm just doing some quick math. That's like 0.3% of the population. Population is a little over 24,000. Only 77 more people became fully vaccinated. That's really low. I mean, that's way below 1%. So
Correct.
things have really leveled off here, getting vaccinated then.
Correct. And I think that's the concern in trying to push that education, the need for vaccination, because without it, we keep seeing our town's positivity rate going up and the number of positive people going up. And we can see the spread in age from the people that are now becoming positive is the concern.
Well, yes, I mean, we're not going to give up on educating people, but it certainly is leveled off, and this is not a new concept. This has been going on a long time. Vaccination's been available for a long time. So I'm not sure, are we getting any new people interested in now getting vaccinated who have not been before? I think it's a question. And now, of course, we're talking about additional doses.
We're finding some people, it's getting difficult to make some appointments now for their second shots. Some people I've talked to are waiting, 1 to 2 weeks to get a second shot. Some are waiting that long to get a third shot booster. So where it was readily available probably 2 weeks ago, it's becoming more of a challenge for people to get an appointment at any of the local pharmacies, grocery stores, or even working with the county. Last week had a large number of people sign up that they had to put a cap on. I think it was around 400 to 500 people. So the vaccine's available. It's just coming out a little slower than it had been a couple weeks ago.
Interesting. The same thing's happened with the flu vaccine. It's very difficult to get an appointment as well. It just seems to be a paucity of a vaccine here on the Cape.
Okay. The homebound people that we vaccinated in April, we're planning their booster shots hopefully within 10 days-ish. We're working with Outer Cape Healthcare right now through the Council on Aging, Diane Kane up there. And we've submitted the list, and we're putting in a request for almost 100 homebound people that will need vaccinations. Okay. The group of people, the homebound, like I had mentioned, is being directed by Diane Kane at the senior center. Anybody listen that hasn't been contacted already should contact the senior center. They have tried to reach out to everybody and pretty much have talked to everybody on homebounds, but there's been a few people that For some reason, they have not been able to get through on the phone. Fire department is coordinating again, providing the vaccinations through Lieutenant Chris McMahon at the fire department. We'll have coordinating fire teams to go out to do the homebound probably over a 7-day period. The first time the funding for the administration was through the COVID money that was provided through the federal state governments. And now the town is funding the fire department now to issue the vaccination. So that's something that we're currently working on daily.
As to the senior center, what's the restriction on the age of the people who would like to get vaccinated there?
Right now, it's just people, this group is the homebound people that cannot go to any of the walk-in clinics.
Okay. thank you.
And this is their second shot. And we know some people status has changed from homebound in April. We probably have some new homebound that we're talking with right now. And we also have some homebound that have relocated. So we're trying to stay in with touch as homebound people as best we can. And that's being coordinated through the Senior Center, Diane Kane. Okay. The health plan that the Board of Health has put together that I drafted up for the board is the mask advisory the board put forth August 16th for indoor public areas, and then monitored the data. And as we remember from looking at the chart, the fourth wave was just about starting Delta at that time. Then in November, at the Board of Health meeting, the board issued a mask update for indoors at town buildings for boards, committees, and people in the audience. The board would then continue to do education, either through getting data out on social media, Chamber of Commerce, working with the schools, code red calls. Okay. And then monitoring the positive cases and vaccination rates, and we discussed it at the meeting on December 6th, where we are tonight, to see what other potential safety steps the board could take. The board is using the guideline of positivity rates that are over 5%, and if vaccinations are under 80%, the board had discussed taking additional precautions. So with that, the update for tonight for the board to discuss as we go forward with the draft regulation is an advisory. But we also noticed the board that the county health department has a regulation too. Number 6 up there is we're also asking the county health department to assist with town vaccination clinics for children and adults. That a town as large as Yarmouth, where we, 24,000 people, and we still need to get more vaccination clinics within the town, is something that we've asked the county for, to try to make that available. The county right now doesn't have the staffing to provide each town, but I've mentioned to them that they should look at towns with high positivity and low vaccination rates and the number of positive cases. So I know that the county's looking at additional staffing. Okay. Vaccination clinics of availability that I mentioned earlier at the local pharmacies, grocery stores. It may take some time to get an appointment, but there's still some vaccine available. Elementary school last Tuesday, provided a clinic for students and parents, and did about 150 students and parents over at the Mattakees Middle School, working in with the county health department. Okay. We did a McDonald's Clinic Saturday. We had 3 children, families come in with 3 children, 3 separate families. We were hoping for more, obviously. McDonald's had put it out on their Facebook. We were prepared to do at least 30. We had 2 nurses available. So we will continue working with these children when their time is up in a couple weeks. And we'll be working with the McDonald's and the visiting nurses who we use for this clinic to see what else we could do. Bass River Pediatrics on Station Ave is providing vaccination just for children on Saturdays for their patients. So they've been reaching out to their people also. And then the county health department office clinics twice a week, either at their office location on 6A in Barnstable Village, and they're also down in Orleans. Okay. This is the school clinic last Tuesday with one of the county nurses providing the vaccine. Good. Worked out well in the Mattakees Gymnasium. People could check in, and they had a couple tables where parents could go to one table and students go to the other table. Okay. Okay. Our McDonald's clinic on Saturday, we believed it was well publicized through their Facebook page, and we'll continue to reach to McDonald's who wishes to participate as much as they can with any vaccination clinics and what they can do to support us by making their place available. And the children can come in, and they also get a Happy Meal after the vaccination during the waiting period. Okay. We had a question last week. I don't know if you want to talk about this a little, Dr. Bosky, about immunizations.
It's specifically if someone has been infected before and the decision whether they get vaccinated. Is that the question you're referring to?
Yes.
Yeah, I mean, that's, as I mentioned at the last meeting, that's pretty straightforward. I mean, the science is there that a person who has been infected by the virus, certainly they develop antibodies, and after getting a vaccination after that, have additional antibodies or more protection for the future. So it certainly is indicated in the literature that a person who has become infected prior to vaccination, it does make sense to get vaccinated if someone wants additional antibodies and protection for themselves and friends and loved ones. You have to keep in mind that with higher levels of antibodies, the virus is going to spend less time in our bodies. We have a limited amount of time to spread the virus. So that's part of the problem we're running into, I'm sure, in town. If someone's not vaccinated, the virus is transmissible for a longer period of time.
Including to people who have been vaccinated.
Absolutely. Once again, I'm not sure if we're getting the point across. I agree with Mary that someone who's been vaccinated, you still get infected like anyone else. But your illness is not as great, and you're less likely to go to the hospital, and you're less likely to die. You know, think back, the statistic there was 44 deaths in our town. And remember, it started 2 years ago. One person became infected on the other side of the planet, and 44 people in our town have died.
Bruce, can I ask a question?
Certainly.
Is Barnstable County still doing a clinic, a vaccination clinic every Thursday?
Yes, they are. And they do ask for a call to schedule appointments. They have been full last week. They're not encouraging walk-ins anymore, but that would be the clinic on Barnstable County on 6A in the Village.
Do we have information on our website for people to be like a link so they'd be able to schedule a vaccine?
We could do that.
Just because I know I looked there just out of curiosity because I follow them on Facebook, and it looks like they have some appointments and they're giving shots. It looks like every 2 minutes or so.
We could look into putting something up on our website of those dates and a phone number.
I mean, we're fortunate that it's close enough to us that it wouldn't be too much, that it's close enough that they wouldn't have to travel too far to go have one. Because I know retail pharmacies right now are stretched very, very thin.
Yeah, most of the pharmacies are doing online signups, and I was able to get. I wasn't able to get an appointment, but I was lucky enough to get a shot just as a walk-in. And that's probably not something that they want to advertise that they do, but you know, it's if there's somebody who's really needs one, I guess my point is it may be worth just walking in somewhere and trying. But to the chairman's point of the vaccination rate sort of plateauing, you know, it seems like we may not have that many people on the fence anymore about whether or not they want the vaccination. You know, it would be really interesting to compare the vaccination rate for COVID-19 to any other vaccine, the flu vaccine. You know, is it 73% of people in town getting the flu vaccine? If that's the case, then can we really expect more people to get vaccinated for COVID? I don't know.
Yeah, it seems very different this day and age. You can think of how many people have gotten their mumps, measles, rubella, hepatitis, polio vaccines. I'm sure those are closer to 100% in our country. So this is quite different.
One other question that I had, and I don't know if we have the data here, but I'm wondering what the positivity rates were during the other spikes, the other waves. I was trying to think back where we were. Were we above 10% at one point in time? 12%?
Anyone have that in their head? I don't.
I don't.
Okay, it's for the next meeting, I guess. That's a good
Just to
question.
give it some perspective, you
Yeah.
know, like, because, you know, 5% to 7%, that seems significant, but, you know, I've talked to a lot of people and they say, well, that's, you know, that's 5 out of 100 and then it's 7 out of 100. So like, I don't know, I'm just trying to think what really puts it into perspective when we look back at where we've been over the past year or so. Obviously, it's trending up.
We haven't even talked about Omicron and how, at least for now, the data is showing that it's highly infectious. So I think that we can look forward to a higher positivity rate in the coming weeks, months, as Omicron kind of seeps into our population. There's already a case in Massachusetts, and it's likely to spread certainly fairly quickly.
It's true. As the temperature goes down, people are obviously spending more time indoors. Holidays are coming up, parties are happening. Yeah,
Right.
It's hard to be optimistic. Just a point, if anyone from the public would like to come forward again, just really looking for a discussion. I'm sure that's how all the board members feel. Any comments, someone from the town, another opportunity.
I got one.
Yes, we do have one person that would like to speak, Mr. Chairman. Erica will let the person in.
Great. Just introduce yourself. Whoever. Thank you.
You ready?
Where'd you find it?
Just 1 second.
Keep on moving her, she's not going over.
Have to get up and do it.
There you go.
Elizabeth Simon, you're into the meeting. You can speak now. I think you may be muted, Elizabeth. Do we have her?
Yeah, she's not unmuting. Asking her to unmute, she's not unmuting.
Yes, can you hear me now?
Yes.
Yeah.
Just
Yeah,
introduce
all right.
yourself.
Yeah, actually, my name is Vin Cervantes. I'm a voter in North. Can you hear me now?
Yes.
Can
Could
you
you
hear us now?
introduce yourself?
I get the mute right here.
No.
No,
We
we
can
can
hear
hear
you.
you.
I need to introduce him. Why did he mute himself again?
Yes, you can speak.
He muted himself again, Bruce.
I believe you muted yourself again. If you wish to speak, you need to unmute yourself and introduce yourself. Should we
I'm
just?
sorry, I'm back and forth with this mute and unmute thing.
We can hear you now if you wish to continue.
Okay. Yeah, I mean, I've been listening to, a lot of, what you've been saying back and forth about the, infection rates. Oh my God.
I think he's having technical difficulty. He's having technical difficulty.
Yeah. I would say, Mr. Chairman, he's having technical difficulties staying connected with us, so I think we could move on.
Sure. Okay. Certainly, you can contact the health department at another point. So, board members have some ideas, thoughts.
Well, we can still move on with the presentation a little bit. I think our next thing we had just put on before we get into the advisory, Mr. Chairman, that you had asked to put the Barnstable County vaccination testing policy into the packet for the board. So that's, we don't need to go over it, but that's within the board's packet. I have not heard the status of that county program yet, how that's working. I've asked a couple questions, but have not heard a response back yet. But when I do, I'll pass that along to the board.
So you mean why the county's doing it and individual towns in the county are not doing it?
Correct.
Is that the question?
That is correct.
And this is for vaccination of town employees as opposed to the county employees.
Right now, it's for county employees.
Right.
Correct.
Okay.
Okay.
Certainly get back to us if you learn something from the county, why that's not spreading to the towns.
Correct.
Okay, thank you.
Okay. As we get through really much the last document for the meeting that you can discuss is the tonight's advisory requiring the use of mask. And I would probably suggest, Mr. Chairman, it's hard to read, that you could just read and go over what the advisory entails.
Any volunteers or not on the board to do some reading? Or not? It's totally optional. Don't all jump at the opportunity.
I don't have it in front of me.
Okay, we'll let you off that one.
It's really small.
Yeah.
It's on the phone.
I don't have it in front of me either right now. I'm trying to pull it up, but whatever D is seemed wrong. Seemed like the wording was incorrect.
Okay, well, I'll read it then. And we'll take a look when we get down to D. How's that?
Sounds good.
So bear with me. Here we go. Advisory requiring the use of masks effective December 7th, 2021. So that's what we're discussing now. And we'll take a vote whether or not to move forward with this or not. Okay, whereas the changing landscape of the COVID-19 pandemic as a result of highly contagious variants indicates a need for health and safety measures to protect Yarmouth residents. Number one, the Yarmouth Board of Health hereby advises the use of masks as noted. A, it is advised that all persons maintain a distance of 6 feet when possible in an indoor location that is open to the public. B, in addition to physical distancing and in an effort to protect public health, all persons, regardless of vaccination status, including customers and staff working within indoor areas accessible to customers, are advised to wear a face covering that covers their nose and mouth, such as a fabric or surgical mask. Wearing a mask is not a substitute for maintaining 6 feet of physical distancing. C, masks or face coverings are advised to be worn whenever indoors on the premises of a business, club, or place of assembly, including but not limited to retail establishments, restaurants, bars, performance venues, social clubs, event spaces, places of religious worship, health clubs, nursing homes, and independent living public areas, and within municipal buildings. Food service establishment customers are advised to only remove face coverings when seated. Lodging workers and guests are advised to wear face coverings inside hallways and common areas. D, this advisory shall apply to performers while performing, in which they are advised to be at least 10 feet away from the public. Yeah, I see what you mean. We'll get back to D then. E, personal services including hair salons, barbershops, and massage/body work customers and workers are advised to wear face covering. So maybe it's meant to be a face covering. F, masks are advised for all individuals on public and private transportation systems, including ride shares, taxis, transportation shelters, and the CCRTA bus. G, this advisory shall not apply to informal gatherings at private residences in which no compensation for use of the property is paid to the owner, and it shall not apply to unorganized gatherings in unclosed outdoor space such as park, athletic field, or parking lot. Okay, number 2. Full vaccination against COVID-19 remains important to reduce transmission, hospitalization, and morbidity from the virus. The board encourages all eligible persons who are not fully vaccinated to get immunized. 3, notwithstanding any provision in this advisory pursuant to guidance issued by CDC, face coverings should not be placed on a child under 2 years of age, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, or anyone due to disability is unable to wear a mask or has a medical exception. The Board of Health will continue to follow COVID-19 data. When the positivity rate goes below 5% or the vaccination rate is above 80%, the board will reevaluate the advisory. The advisory shall be effective 12:01 a.m. December 7th, 2021, and remain in effect until notice is given pursuant to the Yarmouth Board of Health judgment and the public health emergency no longer exists. The Board of Health mask mandate to be worn indoors of town buildings within meeting rooms remain effective as adopted November 15th, 2021. So that's it. And just make sure there's no confusion. Once again, this is an advisory. There is reference here in that last paragraph to a mask mandate, which was about the wearing of indoor town buildings and wearing masks in meetings. That's that's the advisory that's on the schedule for tonight.
So Deborah, how should D read to be clear?
Sorry, Mary, I was muted. It says they should wear masks, mask if they're more than 10 feet away. I just think that's not right. If they're more than 10 feet away and performing, they shouldn't have to wear a mask.
I think that was probably the intention. Let's, so what would be a better way to word it then?
Shall not, I guess, instead of shall.
This advisory shall not apply to performers? Is that what you're saying?
Yeah, if they're more than 10 feet away.
Right. Okay,
Sounds fine.
Yeah. Yep.
And then my only other question is if I could just get some clarification between an advisory and a mandate for everyone listening.
Director Murphy, you want to try that one?
Yes, a mandate would be more of a regulation that we would, the board would hold a public hearing on, and there would be fines associated with any violations. So this is really a stepped up enforcement or moving forward in precautions. The board is moving forward with a advisory first, and should things change, positivity increase, the board next step would be to consider, one option would be a mandate regulation with fines associated.
Thank you, Director Murphy.
Yeah, I mean, those 10 feet is probably to permit some of the venues to stay, with performers and maintain their businesses. I think that's what the increase from the 6 feet is from, so. Anyone aware of any other comments or anything they've heard from the public? Anything that we should be talking about, considering here?
We do have somebody addressing the chat. I'm not sure if people can see that, but.
The person can come forward, yeah. It's been nonstop here by this person here. As I said, people are welcome to address the board, but I guess they're not interested.
We'll try to let somebody in right now. Let's, is it a chance to welcome somebody now?
Okay, he's back.
Oh, you're back. If you'd like to speak, just identify yourself, sir.
Yeah, hi, can you guys hear me now?
Yes, we can.
yes.
Okay, sorry, there's some tech difficulties or whatever going on.
Yes, can you identify yourself?
And I'm going at Simmons meeting here. I know you guys have you spent.
Excuse me 1 second. What is your name?
Yeah.
Just for the minutes, for the record, we just need to know who's speaking. That's all. Your name again, sir?
Still having problems.
It's coming across garbled.
Yeah, he's still having problems.
He's still having difficulty that we're unable to hear him, or he's gobbled.
Okay.
Right.
Along that.
He's not hearing anything you're saying until 10 seconds later, and everything he's saying.
Do we have more people in the chat that we need to let in, or?
They didn't raise their hand.
I don't see any hands raised.
Okay, we are,
His connection.
that is a poor connection, so we're not able to go forward.
Bruce, have you been getting any comments to the department? Anything we should know?
Yes, the person can relay any comments to the health department. I can relay them to the board.
What do you want, Bruce?
That's it. Nope, I would say there's there's no one else waiting to speak, Mr. Chairman, board members.
I mean, certainly, wearing a mask is an inconvenience, is sort of how I see it. There's concern in the past, and maybe it still exists. We really haven't heard from people about what happens, walking into the restaurant and all. The way this advisory is written is that, yes, someone walks in with a mask, you can take it off when they sit down. My feeling is people would feel safer coming to a restaurant. People who have health problems be able to go to the restaurant and be more secure. They're not going to get infected. If someone who's has diabetes or heart disease, someone who's immunocompromised because they take medication for arthritis, psoriasis, or bowel disease, people who have had transplants, people on chemotherapy. These are people who would feel, more secure going to restaurants, being out there in the public, into stores. So that could help business. But yes, it's an inconvenience, but it may, certainly look at it from the point of view it's helping people, not so other people don't get sick. That's what it comes down to. Someone getting sick and potentially very sick or perhaps dying. So that's sort of what we're discussing here about people putting a mask on in certain venues.
They're commenting, but they're not saying anything.
Since it's just an advisory, I guess I would have a hard time understanding why anyone would object to it. There's no enforcement involved.
Agreed.
It's simply saying that in our best judgment, this is what we are advising people to do, given our look at the data and the increasing positivity rate and the new variant that's on the horizon, and the Christmas holidays coming up. I agree with Hillard. I mean, I think everybody's tired of wearing masks, but I've certainly enjoyed not getting colds like I usually do a couple of times a year. And I'm sure it's because I mask all the time when I'm indoors, but that's just me. I would certainly support this advisory. I did speak with the executive director of the Chamber of Commerce last week, and she did say what she told us at the beginning of the meeting, that the businesses in town were concerned that a mask mandate would hurt their business. Again, that's kind of tough to understand, but I do realize that I'm not in a business asking people to put their masks on. I think the advisory should not have that effect on businesses.
Well,
I would hope not.
hopefully the advisory keeps numbers down and more serious action isn't required.
Right.
That's our intention overall, obviously. We're just here to protect the health of people in town.
Right.
So I'm going to make a motion that we accept the advisory regarding the use of masks pending the addition of, the amendment to letter D, inserting the word not between shall and apply.
A second.
Any discussion? Any further discussion, anyone? Okay, take a vote. All in favor of the motion, raise your hand and say aye.
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 Okay, that's 4 votes. That's unanimous, and it goes into effect first thing tomorrow morning. Okay. Old business. Director Murphy?
The next Board of Health meeting right now would be January 3rd. Due to the holidays, this is the meeting that we had planned for this month. We'll closely monitor the positivity and vaccination rates, obviously. But the next meeting would be right now planned for January 3rd. Unless the rates level off, we would probably go to the 10th, but those would be the two dates that the board members should maintain for a meeting.
I'm okay, unless there's some, major change that needs to be addressed. We can have an emergency meeting if need be, but let's hope that's not the case. Anyone else? Any new or old business? If not, we can close up shop here tonight.
I just want to make a comment here. I know we just voted on this, and I'm addressing this after the fact. This says advisory requiring the use of masks. I'm just wondering if that creates a little bit of confusion, that the name of the article there, advisory requiring the use of masks.
Yeah, it should say recommending the use of masks. That's good. Good catch. Good catch, Eric.
Yeah, good pickup. Well, we can certainly make a motion for a correction to it. It has to be a separate motion, and we can do that right now. Eric,
Okay.
want to make the one change?
I
Make a
think
motion
I think I can do it. Yeah.
I know we can.
So I move that we rename the mask advisory here to say advisory recommending the use of masks.
Second.
Any discussion? See there none. All in favor of the motion, just raise your hand, say aye. Aye.
Aye.
Okay, it's unanimous. So we'll make that one change in the first line here of the advisory.
I would like to make one other comment too, and that is that can we get signs out, Bruce, to the businesses in town?
Yes,
Just
we can.
Real simple.
We can pass that along. We have done that in the past to the chamber and made it available to businesses. So yes, we could do
Great.
that.
Okay, thank you.
Yeah, you try to take some of the burden off of store owners and all. Once again, we're advising it, we're recommending it. That's all
Right.
we're doing. And that may
Yeah.
help store owners, restaurant owners, and putting them in a tough spot. They're not there to be enforcing it, obviously.
Right.
Okay, so
I move that we adjourn.
Second.
very good. All in favor, say aye.
Aye.
Thank you, everyone, for participating. All right, stay healthy.
Good
Take
night.
care.
Good
You
night.
too. Good night.
Night.